Let's do some rapid fire question answer. I got these from my Instagram stories from a couple days ago. Appendicitis usually starts with generalized belly pain, so kind of all over, and then moves down to the right lower quadrant as it progresses. Usually have some nausea, a little bit of vomiting, sometimes some diarrhea, usually a low grade fever, not like 103, 104, usually like 100 point something or 101. Poor appetite, and usually the kiddos say, you know, when their parents are driving them in, every bump in the car hurt on the way there. A lot of times kids are refusing to eat and drink because either their throat hurts or they just don't feel good, so Tylenol or acetaminophen suppositories, you can use the brand name Fever All, can help them get feeling better enough to drink. My husband is allergic to cats, so I googled hypoallergenic cats, and Balinese was one of the cats that showed up on the list. Hypoallergenic means less risk of allergies, not zero, and so I wanted a hardy cat because I've got a bunch of kids, and they're a very vocal, playful, hardy breed, and so all of my girls are Balinese. After I graduated from high school, I got my 4-year Bachelor of Science degree in biomedical science. I did 4 years of medical school. I did 3 years of a general pediatric residency, and then 3 years of pediatric emergency medicine fellowship. I've been at my current job for about 8.5 years. Because I work in the emergency department, I refer back to the pediatrician and potentially specialists like neurology, neurosurgery, orthopedics, GI, pulmonology, cardiology, etc. I don't refer to OT, PT, speech, dietary, audiology. Those are things that a primary care doctor or the specialist would refer to, but not from the emergency department. The most helpful thing that people can do in the emergency department is communicate information accurately and quickly, because there's so much other stuff happening in the background. There are some things that you will almost always need to tell someone. Does the child have any medical problems, medicines, allergies, any surgeries? Are their shots up to date? And then maybe pertinent medical history in the family. No hate to anyone, but sometimes the non-primary parent doesn't know a lot of that information. And so if you are the primary parent, you can write those things down on a piece of paper and send it with the not primary parent, so it helps them remember. A lot of vitamin K deficiency bleeding is spontaneously brain bleeding, and that is obviously life-threatening or fatal. And every single time that I've told the parents what is happening, they've said, I didn't know that this was a possibility with refusing the vitamin K. And influencers definitely don't talk about it. It's not that common because most people get the vitamin K at birth, but when you don't, the risk is actually fairly high. So it's definitely something to be aware of because it's absolutely devastating, if not fatal. Bird flu is flu A, but not all flu A is bird flu. A majority of the flu A we're seeing right now is H1N1 or H3N2. But bird flu is the reason that we're having expensive eggs and egg shortages. There were 0 eggs on the shelf when I went to the grocery store the other day. And we could have issues with dairy as well, and potentially beef because of bird flu with cattle and chickens. And we've got some issues, so keep your eye on bird flu. It's not good.